now carry on the first panel, in which we will discuss how digital health tools can help tackle a pandemic, such as the one we are currently experiencing. Increased use of technology this past month when it comes to healthcare, telemedicine, symptom checker, remote monitoring has been used. So let's start with this panel because many technological solutions have been used worldwide those past month to help tackle the COVID-19 pandemic. Whether to detect the first symptoms, track the virus, carry out tests to support the population in accessing and receiving healthcare, or living through this unprecedented time. In this session, we will discuss the role played by technology those past month, the regulatory and privacy challenges associated, as well as the consequences on the global healthcare systems and citizens looking at the future. So let me start introducing our stellar experts. You'll find in your screens, we'll have Carolina García Vidal, Senior Specialist in Infectious Diseases Department in Hospital Clinic in Barcelona. We will also have Samir Puhari, member of WHO. He's working with the newly established Department of Digital Health and Innovations at WHO. Dr. Jordi Serrano Pons, founder and CEO of Universal Doctor. Miguel Muñoz, here with me as well, economist and head of business development of Mediterra. And Roger Slim, senior policy officer at the Information Policy Directorate of the Dutch Ministry of Health, Welfare and Sports. I would like to start talking about contact tracing. So many contact tracing apps have been implemented by governments those past months in the context of COVID. But are they efficient, or do they really make a difference? Let's discuss it with all of you. So Dr. Jordi and Miguel, if you want to stay here with me, please. As explained, you will find Roger, Carolina and Samir on stream. But Jordi and Miguel will be here with us, so take a seat, please. Thank you very much. Thanks for your time.
Hello.
So I would like to start this panel or the conversation asking to Roger. Roger, the Dutch government deployed contact tracing on a national level. What solution did you choose and why? Or can you share some results? Good morning.
Yes, I can. Good morning, everyone, and wishing you all a good panel discussion. Yes, I hope everyone hears me well. Hello from the Netherlands. Yes, I can tell you something about the development in the Netherlands of this contact tracing app. I can tell you it took a very long journey before we came from thought in March all the way into national rollout on the 10th of October. A big challenge was that at the time, but also currently, we were facing with quite some, let's say, incorrect perceptions in society, politics, that this app could potentially track people down or could be used in any way against them. So this perception, we knew it was caused by stories and reports and apps currently being used in mostly Asian countries like China and South Korea. Well, instead of ignoring these concerns, because these perceptions were based on concerns, we tried to address them by being as open and transparent as possible in our work. So the moment when we had decided to build a national app that supports the contact tracing efforts of our local healthcare services, there were actually two elements that we not only considered very crucial, but unnegotiable in ensuring a successful nationwide uptake, which is privacy and and data minimization. And with these two elements, we knew that an open and transparent process on our decision making and on the technical choices made is essential to build trust. And you will hear this a lot in my stories, because trust, especially trust, is key in order for people to use this app. So what did we do? So in March, we organized a market consultation to understand already out there in the market when it comes to contact tracing apps. And we have actually, made everyone participate in the country in this review of these apps. So we broadcasted live on YouTube, the reviews of several apps that we had shortlisted, of which we thought, oh, these might be quite successful to be taken up. But the conclusion was these apps did not fulfill our needs. So we had to go back to the drawing table, and we concluded we had to develop an app ourselves, which we did. And this app had to, adhere to data privacy preserving principles, or as we call it, a decentralized app that is fully adherent to the Google Apple exposure notification protocol. The fact that the app would be fully compatible with Google and Apple operating system is very important, because we heard of stories of apps being not really being compatible and having to build bypasses to make it work on Apple and Google phones, and this resulted into a lot of problems with Bluetooth not being open all time, the Bluetooth, and this is not very handy, so not very favorable. So also throughout the whole process, we underlined that the app itself is not a technical exercise. It is also an exercise where we have to involve behavioral scientists and epidemiologists, to make sure that the app that we are building is actually in line with what the needs are in society. We are trying here also to influence specific behavior. Another thing, what we really focused on is that the app should have added value to the current processes of the local healthcare services. So you do not want to build an app that is completely separated from the local healthcare services processes with regards to contact tracing. So we had to involve them from the onset, making sure that whatever we are developing is in line and can fit into the current processes. Another thing also, and this, it's very important, because sometimes you hear that, an app is being presented as the solution of the pandemic, and we've always mentioned that an app is not the solution, but a tool to support local healthcare services in their contact tracing efforts. So throughout the whole process, from March all the way until national rollout on the 10th of October, we have shared every single bit of coding of our app on GitHub for everyone to review. We have received a lot of input from experts, from citizens, to even people from universities, and we have taken up all these inputs to improve the app into what we have now, and we are still updating it ever since. I think the app currently is quite a success, if I may say so myself. It's downloaded 3.7 million times, which on a population of 17.5 million is about 21% coverage. And up till, I think, yesterday, over 15,000 keys were uploaded, meaning 15,000 infections were being uploaded or registered through the app. So I think this is the process that we've gone through in the Netherlands. Trust is very important in a successful uptake of contact tracing apps.
Roger, for example, in France, French President Macron recognized that a Stop COVID app was a failure because only 400 notified cases. What did you do differently in Holland, comparing France, for example?
Yes, well, of course, I cannot speak about the decisions made in France. What I see, what is an inherent difference between the app in France and the one in the Netherlands is the different use of technology or methodologies that we use. Whereas in the Netherlands, we said from the onset, privacy preserving is a very important element, meaning that we do not want to have a central server where all the data is being processed, because you can imagine having a central server, it raises quite a privacy issue, especially in the Netherlands, it's very sensitive having a central government-owned server. In France, on the other hand, they have developed an app that is different, where indeed the processing of data is being done centrally at a server. And also at the same time, because this app was not quite compatible with the Google Apple exposure notification protocol, they had some hiccups. There were some hiccups from the start with the app, battery drainage, people not using it at some point because their battery is finished in an hour or two or something like that. So, yes, different decisions, but I think the way we think.
Sorry, talking about interoperability across Europe, is there a way to synchronize the different apps when people are traveling?
Yes, well, good that you mentioned it. I think, I think already soon after science came in, that many European countries, I think about 24 already, had the intention or were developing and coming up. The discussion was quickly raised on how to ensure that all these apps are interoperable. Because with the free movement of people principle in the EU, policymakers at the European Commission, but also at member states, wanted to prevent that European citizens were potentially faced with a wide range of apps that had to be downloaded if they wanted to travel around the EU. So the European Commission, together with the European e-health network, which is a voluntary network represented by all member states to make strategic decisions on digital health, they quickly took the lead in developing a European solution called the European Federated Gateway Server that would connect all these apps and have users only download their own national app. But there's only one condition, which is only apps that were built adherent or in accordance with the Google Apple notification, exposure notification, would be connected to the solution. So in effect, almost all European countries, 24 I would say, or 23, can connect, except for France, unfortunately.
Thank you very much. I'd like to continue with Dr. Carolina. Hope you are just right there. Carolina, can you tell us a little bit more about the AI solution you put in place? How does the algorithm choose patients? We can hear you quite well. Just let us check the sound.
Sorry. First of all, I would like to thank the organization for inviting me to this very interesting meeting. And I would like to share our solution with you, starting to explain 3 steps. The first one, you have to understand that during the peak of the first wave of the pandemic, we have to attend more than 2,000 patients the same day. And we are more or less 200 doctors and 12 doctors with a higher degree of specialty in infectious disease. So the situation was very complex. In that moment, we were attending patients with a new disease, very severe disease, and a disease with a high mortality that we really have no good idea about which one was the best way to work with these patients. So the situation was highly complicated, and the first feeling that we have is we need to control this situation, because if not, it's out of the control and it's very difficult for all of us. In that way, the first step was that the milestone of our project is that we have one intelligent system able to read and retrieve data directly from electronic health records in a real time and with a high quality of data. That means that when the doctor, nurse, or whatever is working with their computers in hospital clinic, we have a system able to keep all the data that we need and to put in a format, in a data lake that is able to analyze in real time. And this is very important. We call this system SIL, Sistema Inteligente de Lectura y Dispensación de Datos in Spanish, and that's the first point that that we are very different from other centers, from other hospitals, and from other research teams. With that, we collected, the first step that we did was to put the computers following all these 200 patients that we were not able to visit at the same time. And we mark some items, no, to say, computer, when you see this, please tell me, no? And with only one person with a high degree specialist in infectious disease, and with one person looking the screen of one computer, we were able to control all the things that were happening in these 2,000 patients. The second step was that we were able to find some patterns that allow us to do something that was very important in that moment. No? When we think in COVID, we think in one disease, but with these patterns, we discovered that COVID, when patients becomes really severe, they have almost 3 different diseases. No? One is led by a very high inflammation in the patients. The second one is due super infections, and the third one is because these patients may have thrombotic complications. No, so after the identification of these patterns, no, we make that the computers, no, look for these patterns and notice us in a very quick time, no. And with this work, we offer to our patients a personalized treatment, not a general treatment for all patients. If you have an inflammatory pattern, you are going to receive an anti-inflammatory treatment. If you have super infections, you will receive antibiotics or antifungal therapy. And if you have coagulopathy pattern, you are going to receive anticoagulants. And the third step, no, when we had more than 3 trillion pieces of data with a high quality, as I explained you before, what we do was neural network algorithms trying to predict which patients are going to be in each of these patterns. No? With this step, what we really want was to make not only a personalized treatment, also a very early treatment. No? Before you enter in this pattern and the situation becomes very, very severe, we start that treatment, so we were able to save a high number of lives. And in fact, we were able to publish that we reduce our mortality when we start this system in more than 50% of the case, so we feel very proud of that.
Thank you very much, Carolina, for all this information. I would like to continue with Samir. Good morning. Samir, from the World Health Organization, how do you see the potential of digital health?
Thank you so much. Good morning, everyone. Let me first and foremost thank the organizers for having this effort of thinking about how digital can help in these difficult times. Sorry I can't be there in person, but I think it's giving the point that digital has the impact and the potential to deliver no matter what. I think that's the first point to make in there. See, digital health, it's a very good question, is digital health's role and what is the potential? Digital health has been again, time and again, proven to be an enabler. And we have to use that enablement of the digital health to the maximum possible use. It has to be adapted, it has to be used in the relevance of the problems that have been created. It is extremely important, and I think more than ever before, not just COVID, we've seen in other pandemics also, but COVID has highlighted the need of the appropriate application and enablement of digital health across. Particularly the member states, we've started these discussions. All the countries, the member states, agreed to a resolution on digital health in 2017, and that has set the stage. We are in next month, actually, just a few weeks actually, out of launching and to the member states at the next World Health Assembly, the global strategy on digital health. And there are 4 main components of digital health, and this gives to explain what are the main, what is the potential of digital health and how it has to be enabled and used. The first one is collaboration. We need to realize everyone working in digital health, that collaboration is key. You cannot be working in isolation. Ministries of Health have to work with ministries of ICTs, private has to work with public to make sure that we can leverage that potential and the ubiquity of technology to maximize. There were examples about the contact tracing. If we already had solutions which were used by every individual, that would have become so easy. The problem why some countries did not get it to work was because we did not have everyone using it equally. There was no potential mechanism of applying that. So that's why I think collaboration in getting that infrastructure is very key. The second point is implementation and scale. We have to find mechanisms of reaching out to every population, leaving no one behind. It's not just smartphones, it's not just mobile phones, it's every possible reach that we can apply to every individual, maximum at least outreach that is possible. There's a role for broadband to provide that broadband outreach to everyone. There's a role for the ministries to make that services available to everyone and reach out as well. And there is a role for business to make sure that this is applicable and scalable. We have to look at other models that has been done in the past. The third part is governance, to have a proper governance structure. Whether it's the ethics, it's the regulations at the country level, or the governance units running these digital health components, so that the role is to enable it to maximize the impact of digital health. And the last one is people-centered care. For the first time in history, we have more cell phones on the planet than human beings. This is an opportunity. And we have to leverage that through the people-centered care. The governments have the opportunity to reach directly to the end population. And so if we can bring these four potential areas and convert them into using digital health as an enabler, there's always the fear of, is it taking over health? Are there the worries about digital taking impact? Let's understand, we're not saying that digital can take over. We are far away from that part. What we're saying is use the existing infrastructure, the ubiquity, and apply that. I think that's where the potential of digital health comes out. And I think we've seen that. I don't think that's a case to be built at all. I think it's a case of how can we take it to the next level of making a change in the life and healthcare through the application of technology. Thank you.
Thank you, Samir. Miguel, thanks. Good morning. Thanks for your time. Could a solution like Medicare help the control infection rate?
Yes, from our experience, Medicare can help both to slow down the infection rate by isolating those who might be infected by COVID-19, and also can help with those who, even though they are feeling similar symptoms to COVID-19, they are suffering from another disease, such as a common flu or asthma crisis or something. And here is where the real challenge comes, because we have learned that for these tools to be really effective, they have to provide a differential diagnosis. And what do I mean by differential? So for those cases with a high probability of being infected by the virus, we have to differentiate those cases which are not severe against those that are severe, because the first ones can be isolated, but the seconds might be needing urgent medical assistance. And on the other side, for those cases showing similar symptoms but suffering from another disease, it is crucial to provide them an alternative solution to what's going on with them. Because if you tell to a patient, okay, we suspect you have a low probability of being infected and nothing else, this patient will probably end up going to an emergency department. And this is exactly what we want to avoid, unless it is strictly necessary. So it is very important also to provide to those patients suffering from another disease continuous care according to this different disease. And from here comes out another benefit, which is that symptom checkers can help healthcare organizations to organize their peaks of high demand, avoiding as well, and at the same time, oversaturation in primary care services. So summarizing, these kind of tools, we think they can be truly effective as long as they focus obviously on symptomatics. They provide a differential diagnosis, and also they provide the most appropriate next step for those who are suffering from another disease.
Oh. Jordi, in your case, for example, and as a founder of Universal Doctor, very involved in a digital global health, how was Epidemics launched so quickly?
Well, thank you very much for inviting us. Well, Epidemics was launched in the right moment because we were prepared. We are always working in the space of digital global health. We developed some tools for Zika, for example, and we were also prepared for the Ebola outbreak already. We finally did not develop an app, but we were almost going to develop an app for Ebola. And then we developed these tools for Zika and other small outbreaks. And basically, we were ready. We wanted to launch something. And it was at the end of February, beginning of March, when we say, let's develop an app, obviously. But at that time, the Apple Store and Google Play were very collapsed, no? And all that has to do with COVID was difficult to be uploaded. So we decided to launch a web app quickly, and we launched it on the day that the first closure, the first confinement, no, was announced in Spain, 10th of March. And 3 days later, we had reached just 1.3 million visits. Now we have more than 2 million visits, but only in 3 days we reached this number of visits because we were prepared and still governments were not. And basically what we did is we aggregate a lot of information from many hospitals, validated sources, governments, of course WHO, and we did it in a record time, aggregated, and there was a snowball. And what we wanted to do is help people to find the right information. And from there we continued working. We created Epidemics TV, and right now we have been developing something very nice that we are pre-launching today, and we will announce a big launch in next weeks, something called Epidemics Studies, which is something that wants to empower researchers. In that sense, we want to help researchers to collect more data quickly. So first of all, disseminate their studies. Basically, researchers sometimes have problems in finding funding, but also disseminating their own studies. So it's a platform where researchers will be able to upload their studies, disseminate them very quickly. Second, we will give them tools to collect data. Normally, they use these kind of tools like RedCap and very good tools, by the way. But we want to proportionate them tools where the main goal is to facilitate open data to science, because sometimes people with good intention collect data, but at the end it's not given openly. We are seeing these days that a lot of people is asking for open data, governments delivering sometimes PDFs with good intention, not CSVs. Well, in that sense, we are proportionating as a second goal on that platform, a platform to collect data, that the only condition to be pro bono is that you will deliver the data in an open format, of course, respecting all the GDPR compliance things. And third, finally, to enhance them in the capacity of getting funds. If they have already a crowdfunding platform, they will be able to aggregate their crowdfunding platform in that platform. So it's dissemination, getting more open data, and crowdfunding. And this is what we are launching with Epidemics Studies, and we are very happy.
Those three are the three main goals, no, for this app. What can we do with technology that are not doing already or have not been doing those past months?
Well, with technology, you can do many things, no? But obviously, technology has its limitations. As Carolina was saying before, first of all, organization. No? If you put a lot of technology without any organization, nothing will happen, or even sometimes it will be worse. Once you are organized, and you know, technology must be here to help us to improve these flows, no? To transform the processes, but it's always processes well organized, and then technology can enter, no? And in that sense, technology, it's been very useful, but still, we, as Roger was explaining at the beginning, no? In theory, contact tracing apps potentially can enhance and improve the contact tracing capacity, in theory. In practice, we have to implement them in a better way. The uptake, the percentage of people uptaking that must be higher. There must be no problems with, of course, security and all that, because trusting is the important thing. The technology has no limits as long as it's led by the healthcare people in combination with satisfying the necessities of
Roger,
that.
in terms of data, what's your opinion at this point? What can we do with this technology?
Well, I think it's already a lot by the other speakers. Well, you know, we can do a lot of things already with technology, and what you see is up until the pandemic, you know, a lot of digital technologies especially were faced with a lot of barriers, meaning, you know, legal barriers, governances, etc., but also a little bit of a, how do you say that, conservatism, especially in the healthcare sector, to embrace this kind of technology. But, you know, we are now in a pandemic, and you see that this pandemic has increased the urgency in using this technology as an enabler to still provide the healthcare that is needed. You can see that telemedicine, where, you know, I've been talking a lot about telemedicine services, and now you see it a lot because they need to, because patients are asking for it as they want to speak to the doctor, etc. I think what still is, especially in Europe, we still have a long way to go, is interoperability of health data. You know, you see that we are a patch up of 27 member states, with each have its own, you know, in the healthcare sector, its own uniqueness, let's say. So health data, we are talking about AI solutions, we are talking about algorithms, etc. But in order for that, we need to have the prerequisite, which is health data being interoperable, needs to be done. And I think, you know, it's still a long way to go, but the urgency of that is becoming more apparent now during this crisis.
My next question is, does technology really make a difference? I mean, if we compare the Spanish flu in 1918 to Covid-19 pandemic, people were traveling less in 1918, but had less technology. So compared to today, where travel spreads the virus and high speed, but we have more technologies to help, can really make this difference, Miguel?
Yes, I think that the principles how we tackle a pandemic haven't changed a lot. I mean, either we talk about Spanish flu or COVID-19 or tuberculosis or other infection pandemics, to make it simple and quick, we have to identify those who has been infected, and then we have to figure out where the outbreak is coming from in order to isolate the potentially infected individuals, and then we have to treat those obviously who has been infected. And how we do this, it is about logistics. And the role of technology here, I think, is that it can help us to make these logistics even more effective. We have many examples, and here in Barcelona we've had a lot of examples. I mean, COVID warriors, is like a group of people who has been put their hands on in order to tackle the pandemic. We have many technology out there. For example, we have tracing apps. We have these small kits that can test in 15 minutes. We have enough technology nowadays to make what I would say symptomatic surveillance, because we have much more information nowadays than we have before. The thing is that we could use this technology to make a more micromanagement of the pandemic, or even personalizing the protocols for every single group of patients, or to every single industry. For example, travel industry could be an example. So my answer to the question is yes, technology is making an impact, but we could still use it even more.
Are you agree with Miguel, Jordi?
No, absolutely. This is that Japanese saying, no, that a drop of water is a drop, no? All together it's an ocean, no? And what he was telling before, for example, here in Spain, we set up COVID warriors, no? What COVID warriors did was put all together, no? The knowledge, no? Sharing the knowledge all together, no? That was led by Dr. Andreu Bea. And obviously in other places, for example, the crowd fight COVID-19, no? It's I think they have 50,000 members, no? Connecting scientists. This is the difference. Technology is connecting scientists and doers, no? And this is the big difference of technology today.
Samir, I would like to ask you something. In your opinion, what are the limitations of the current technological tools?
Thanks. I mean, I think it's a good question, and just also continuing from the discussion in the past, in the previous question or point. I think technology has its merits. It's changed our lifestyles. It has got a lot of knowledge to the table. So obviously there's a big plus to it. The limitations are that they have the bad impact also. The infodemic we've seen as alongside the pandemic is a big problem to tackle. We get misinformation, people spreading out incorrect news and details about myths about the pandemic, which has caused a lot of damage also. So I think we haven't addressed those components in the past. We were not prepared for that. I'm seeing amazing, again, with the benefit of technology, we're seeing that collaboration is sparking off. We're seeing the non-health sector coming in, all the big tech worlds, the social companies coming in to help and say, how can we address these problems so that we can maximize the value of health and control infodemics and control the info component part of it. The other part is trust, of course, and I think certainly COVID has happened, and that trust which is growing up or is trying to grow up wasn't there still. So obviously that was a limitation in terms of how technology applied itself, and we've seen variation of that trust level in different countries and how the technology was adapted in those countries. But trust is not something that you can switch over. It will take time. It will be country specific. It will be culture specific, and it will develop itself. I think the solutions are there. They have made a difference. It's a newer, much different world that we live in today. What we had when the Spanish flu was happening, and there are several factors. I think technology works. We've seen in terms of the bots. We were able to reach out to a huge population through the different channels that we have to provide the right information to control that infodemic. WHO and several countries did it themselves. Contact tracing is much more efficient where it's properly applied in the clinical setting as well, in the epidemiological setting, not just the proximity testing areas, but also the traditional contact tracing has worked in several countries, and several countries have used it appropriately. Data sharing, data collection has been efficient, much more faster and much more efficient. And I think it will be very useful also in the procurement and vaccine distribution as we go there. Those things are all technology. The power of technology can apply and enable some of these technological challenges we have.
Okay, and regarding your expertise, what do you think? What are these limitations?
No, again, limitations are obviously not using the right technology in the right time. No, regarding all these digital capacities, on the 1918, they didn't have all these capacities, and they had three peaks, no, three waves. Here now we are starting the second wave. No, obviously we all hope that there is no third wave. No, but of course we know that the vaccines at the full implementation of vaccines probably will be next year, at the end of next year. Mm-hmm. So obviously there is a lot of time. Learning from the lessons that we have learned about contact tracing should allow us to maybe implement these tools in a more personalized way, maybe in cities, maybe in places where there is more control. And that is really the point of, now that we have more experience, how can we implement the lessons learned? And then always again, no, ask the healthcare workers that are in front line the necessities, ask what they need, because then it's when technology, in the case of digital health, no, of course we have technology, biomedical devices, all that is helping from all the fronts, no, in that sense.
Okay, thank you. Carolina, I would like to ask you, in your opinion, what is the role of telemedicine?
Well, in this pandemic, it has been very important because when you have to avoid the close contact between persons, no, there are many things that you can do, as we are doing now, no, talking with people, seeing people, and explaining with communications. No, during the first pandemic, I think most of the external visits in the hospital was done with telemedicine. I think this is a technology is here to remain forever. No, so we have a great experience with that.
From Mediterra point of view, what's your opinion?
With Dr. Carolina. Undoubtedly, telemedicine is playing a key role during these days. It's making a very positive impact, mostly because one of the key factors to tackle the pandemic is social distance. And therefore, telemedicine can deliver telemedicine or healthcare from distance, right? So we have some examples. For example, we can remotely care for those who can receive treatment from home, and by keeping, for example, potentially infected individuals out of medical facilities, so we can reduce the infection to patient. We also can reduce the risk of infection, and very important, from patient to medical staff, right? Another role that telemedicine, for example, is playing is that to help providing routine care for those who are suffering from chronic diseases. And here, these kind of patients are mostly those who are at a higher risk, right? And here, real-time data is also playing a very important role, because it allows to monitor constantly these kind of patients, avoiding oversaturation in medical facilities. We can find many roles, out there of how telemedicine is making a very positive impact during this pandemic. But as Roger said before, I think telemedicine has still many barriers to overcome. And one of the main barriers is the lack of a permanent legal framework providing clear conditions and clear guidance on how to use telemedicine. Because for sure, if we were able to rule the relationship between patient and doctors, they therefore would feel much more comfortable providing healthcare through telemedicine.
Mm-hmm. Carolina, what can we do for more people to use technology? What's your opinion?
Well, that's a good question, but there are many steps that have been talking before, but they are very important that we have to take in mind. No? To use new technologies, all the new technologies, the first one that we have to do is to be sure that this works. And what I'm talking about, for example, we are here talking about data, about the use of data, that is mainly the start point of most of the technologies, but we have no really clear, when we are using most device, where the data comes and which one is the quality of this data. No? And this is a huge concern for doctors, because finally when you have help coming from the computer system or from one thing that is not your mind, you have to decide something for this patient that, well, if you are wrong, this patient may die. No? So you want really to control all the process that makes you take a final decision. No? So I think we're in a very good starting point for use artificial intelligence in medicine to improve process of care, but we have yet to improve the starting point. We have yet to make some regulations about how it is working. We have to teach physicians that artificial intelligence is not a black box, or it's not a black box, no? And we have to prove that when we use all these new resources, the final outcome of our patients is better. No? So I think it's a very interesting way to do, but we are starting now and we have to keep moving. And of course, artificial intelligence in medicine is coming to be a breakthrough in medicine. I have no doubt of that. Because when we have in mind 3 trillion of data, not only 1,000 data, all my abilities, all my skills are much better.
Okay, thank you very much. Roger, what do you think, what are the barriers to use contact tracing on a larger scale? People see it as a tracing solution, clear guidance.
Well, as I said, a very large barrier in a large-scale uptake of the app is especially in the Netherlands, it resorts to privacy. We need to ensure trust. We need to ensure that, from the onset, that people can trust the use of this contact tracing app. Also, what I think is very important is the user friendliness of an app. We often, when it comes to developing technological solutions, when I go back to the previous questions, how to ensure that people use technology more, is that technology by itself is not a purpose. It needs to fit. How do you say that? It needs to serve a specific purpose. It's a means to an end, and it's also with contact tracing apps. It is a tool. This is what we always said. It's a tool to help our healthcare services, and also they need to believe that this specific tool can help them in their contact tracing efforts, especially when they reach a specific peak. Another thing I think is very important with contact tracing apps is that the testing policy of countries should be aligned as much as possible. And with that, I mean that that potentially people could get notifications that they were in the near vicinity of someone who was infected, and most of the times these people get the advice to quarantine themselves for approximately 10 days, let's say, but it would not help a large uptake of the app if people get a notification, but they cannot get tested if they have no symptoms, let's say. They go in quarantine, and at the end of the day, and at the end of the quarantine, they found that they don't have coronavirus. It really reduces the trust in the app. So it's not just the app, but it's also the whole process surrounding doing the contact tracing efforts, testing, etc., that needs to be fully aligned in order for people or for these apps to be taken up at a wider scale in a specific country and society.
In your opinion, what are these barriers to be used in larger scale? What do you think about that?
Sorry, the barriers in large scale uptake of the contact tracing apps, you mean? Well, as I
Samir.
Sorry.
No, I just wanted to ask to Samir, Roger, so sorry.
Okay.
Sorry, I didn't.
No, that's okay. We didn't hear that. We didn't hear that. Thank you so much. I think the barriers, again, as I think Roger has put out very, very clearly and strongly, the barriers are, do we have the ubiquity application? Do we have the trust in the application? But also as an individual, I mean, if you think from your perspective, what are you getting as an individual? Why would I want to use these tools? I mean, it's not just about the specific COVID. Yes, that is of course important, but if we can give a full holistic tools approach for an individual to help manage the pandemic, the situation, but also my health situation and the health condition for myself, for my family, I think that's what we want to see. So we've been exploring how, whether it's mental health issues, whether it's NCDs, in this situation, because there's not just the COVID issue, there's also people who are not getting access to the medication for NCDs. How do you make that facility available? And I think as understanding technology, that level of trust and utility, if you can give more and more resources to that to the individual, I think the uptake and the usage will grow up. The limitations are just binding by what people get out of it and if they're going to use it or not. Of course, we are still, I mean, we have to remember, and let's face it, the smartphone penetration, which is what we're talking about more and more for this contact tracing, is still not there everywhere. That's growing. So we have to also look at how can we use the feature phones or the less smartphones, and how can we apply some of this knowledge to those population also, so that we are not just being, I mean, inadequate in terms of what we're measuring.
On the other hand, and in terms of virtual medical visits and med health in general, Miguel, do you think that have we reached a tipping point where there is no way back?
Well, the quick answer, I think, is definitely yes. And the longer is that, yes, we have reached a tipping point, basically because technology has become a crucial part of our daily lives. We have seen in many other areas like work, in social communications, and we cannot expect the medical field to be less. However, how fast that happens, it will depend on how we as a society are able to adapt technology to people's needs. And just to share an example, why I think that we are in a tipping point is that just a couple of days ago I came across with a report conducted by Accenture, which basically says that 68% of patients are willing to receive virtual consultations if their traditional doctors recommend it. However, only 9% of patients actually received a recommendation by their traditional doctors to use it. And from here, I think we can get two main points. And the first one is that consumer is ready. The market is ready to use telemedicine. And on the other hand, I think we can get from this report that the traditional doctors are a key stakeholder to foster the usage of telemedicine. And here comes again my idea of that it is very important to have a legal framework in order to provide doctors to even more use telemedicine.
Doctora Carolina, in your opinion, anything to add, or do you think actually there is no way back to regarding this virtual visit?
No, I'm sure all the points that has been explained here are very good, and in the real life, because we can talk about regulations, we can talk about many things, but in the real life, telemedicine, for example, has been absolutely imprescindible, has been absolutely important during this pandemic, and I'm sure many of my patients feel really comfortable with that and prefers this kind of medicine because they have not to come to the hospital, they have not to wait in a waiting room. It's really easy to do that, and as I think Rosie explained some minutes ago, if you have chronic disease and your visit is because it's only a regular checking of this chronic disease, telemedicine is very, very important tool for us. So telemedicine is here to remain here, and in real life, many doctors are very happy with that, and many patients also are very happy. Of course, that doesn't mean that the regular visits or the usual visits in the hospital should be avoided. This is not true. Some patients need to come, you need to explore some patients, so probably both the classical way and the new way are going to live together during the next month. But my feeling as a doctor is that we have no problem with that, and we have been adapted to that in a very fast way thanks to the COVID pandemic.
Your opinion about that?
No, even not only telemedicine, but the full technology. There is no way back. No, I think we have seen here a failure. For the moment, governments trying to put contact tracing apps, but a big success. Now we have to congratulate Professor Carolina Garcia and Hospital Clinic because they have been able to implement AI. This is the real breakthrough that she was saying. She published that they reduced the mortality, and I'm pretty sure that she's more comfortable with that second wave with this tool, that they make them be more prepared. So this is the way to move forward, and there is no way back. So congratulations to Hospital Clinic.
My last questions, and I'd like to have it to all of you guys, is in terms of the potential of the current technologies. Of course, that is not applied today. How will it apply in the future? For example, Samir, what's your opinion about these potential current technologies and how it will be applied?
Well, I think AI, as has been talked about, and we're seeing already some live examples of how it's starting to make an impact and show actual impact. So I think that's definitely a big potential wave that will change the healthcare and the way it is applied. Of course, it has to be very well regulated, controlled, because as we've spoken, it can have a damaging effect if not properly done as well. But I think we've seen with the computing processing and going up to quantum computing, there's a huge potential in terms of image processing, in terms of tracking the different levels of data sets and the data points and analyzing these data sets. So I think definitely technology is helping us and giving us some potentials towards how a future of healthcare and public health in general through simple mechanisms, just by using processing power and the spread of data and the availability of data, is making that strong case. Telemedicine has been said. I think that's come out. We're looking at a telemedicine 2.0, if we may say so. It was a different world in the past with different technologies, but now we have a different level of technologies going forward. I think the virtual care will be a big game changer going forward as well, to make that access to healthcare services much more prominent and much more available. So I think definitely there's a huge potential right now as well. Sensors are the other areas. We're seeing huge potential in sensors in just improving the well-being of the population, and how the sensors are working with the behavioral components to enhance healthcare and well-beings. So I think there's already in the near future seeing some great technology benefits coming up, at least. So hopefully in our lifetime we should be able to see some game-changing technology and digital health impact.
Your turn. What's your opinion about this potential of the how we will apply these potential technologies? Could you hear me? We'd just like to know your opinion at that point. Well, meanwhile,
Sorry, I think
yes,
sorry,
please, Miguel.
Apologies.
I think that we tend to look at the benefits of technology in terms of efficiency, or in terms of how it can reduce operational cost, or how much time it can save both to patients and doctors. And technology usually have a connotation of being cold and impersonal.
Yeah. Okay.
But on the other side, I think we don't have to forget that when a patient is looking for care, he is not only looking for the best treatment provided by the best doctor in the region, but also patients are looking for being understood. They are looking to be listened, or after all, they are looking for empathy, right? So it's a responsibility of all the players in the market how we can make technology a bit more human and less impersonal.
Jordi, anything to add?
No, the potential is exponential. No, the convergence of all these technologies will be huge. Obviously, the digital is the spinal cord of all the other technologies. No, all these antigens tests. We are aiming that everybody will be able to test soon at home. No, all these things will be connected to an app. Then the outcomes will be sent to the government, and so the contact tracing will be easier. So I think it's important to foresee the future of technology, not be very anxious now that we have here the second wave and all that, but the technology is here to stay and to support. But again, sorry, maybe I'm boring today, but I insist, no, we have to follow the advice of the healthcare workers, and then upon the necessities, push all the technology that we can there. No?
Okay, let's. We hope so. So, guys, thank you very much for your time. Thank you, Samir, Roger, Carolina, Miguel, and Jordi, for your time. It was a pleasure sharing this first panel with all of you. And let's continue.